Good morning, good afternoon, good evening, everyone, and welcome to this webinar on the new UNICEF estimates on birth registration. My name is Claudia Cappa, and I'm a senior advisor in the Division of Data Analytics, Planning and Monitoring in UNICEF, New York. Before we go into the content of this webinar, I would like to give you some reference to the interpretation services that is available today. So we have the webinar in English, but you will be able to connect through the channel, interpretation channel at the bottom of your screen to get simultaneous interpretation in French and Spanish. You can use the chat box to introduce yourself. And obviously, we will create time at the end of the presentation for Q&As, and you are welcome to write your questions in the chat box or take the microphone when we are going to give you the floor. Without further ado, I would like to now introduce and give the floor to Vidya Ganesh. Vidya is the director.
Excellent, and welcome to everyone, and good morning, good afternoon, good evening if you're joining us from all parts of the globe today. And indeed, it's very fitting that we all do join from all parts of the world, because today we are going to talk about a very important topic, which is birth registration and the launch of the report. But why this topic and this report is important and exciting at this time is really the birth registration doesn't require too much explanation. It really is the basis of a child's legal identity. I mean, the entire story starts and stops there. And the best way for that to strengthen that core of a child's legal identity, and the legal is very, very important, especially in this world where we are facing many turbulent movements of populations across and migration, and when children on the move, the right start in life is guaranteed with a birth registration. So really welcome to this webinar where we will discuss the new estimates of the birth registration. It is a good story, and Claudia will take us through the details. And and what has really been remarkable is really the commitment and the processes through which both the coverage of the birth registration has increased, and also the sustainability of the system that enables that birth registration has also increased. And these were the two important gaps that we had felt even at the beginning of this SDG era, and things rapidly improved and changed for the better. So, as UNICEF, as the custodian agency, we've had the privilege to monitor and track the SDG indicator 16.9.1, which all of you are very familiar, contribute a lot to it, and therefore it's very fitting that we come together to really look at what has been the progress and what are still the work ahead of us. Like I said, the publication looks back at 20 years of data, which draws from an amazing set of data sources, 500 at the last count, and which really is probably one of the few indicators where we can be this authoritative to kind of track where we have come from, and therefore it gives us both the confidence that this can be done going ahead, but also puts laser focus on areas where we can improve and have the confidence to do it. So UNICEF, with all its partners, led by the governments, is working very hard to strengthen many systems, and in particular the CRVS, which has been critical to improve the birth registration, decentralize the services available, and here the health systems and the participation of community has been particularly helpful. And I'll give you a personal anecdote or my personal experience where I had the chance to witness this, and this was in Botswana, where now Botswana has reached universal coverage. That process of universal coverage started about 5 years ago, and when I had the fortune to be there, and we knew exactly where we needed to go, and all it took was a good network of partners led by the government, and I'm happy to see today we have the evidence of that universal coverage. So it's just another way of being assured that this is a target that can be achieved, should be achieved, and this is a basic human right, child rights of a child. So welcome again to this webinar, and let's sustain the progress that's been made, both in terms of data collection and monitoring, and also, of course, the actual task of registering every child when they are born, and promising and fulfilling the every child's birthright, and that it can be achieved. So thank you so much, and I hope you have a good hour, and see you all at the end of the hour. Thank you so much.
Thank you, Vidya. Thank you for your welcoming remarks. And now it's my great pleasure to introduce Shima Sengupta. Shima is the director of the Child Protection and Migration Team in our program division here at UNICEF headquarters. Welcome, Shima. The floor is yours.
Thank you, Claudia. Colleagues, good morning, good afternoon, good evening to all of you. And it's really good to see that there are so many of you online, an indicator of how important this is to all of us. So today is a super exciting and important moment because we released a Right Start in Life, Global Levels and Trends in Birth Registration, which is the 2024 update. And as Vidya said, there is progress, there is hope, and of course, we will have Claudia give us the details. So for me, this is extremely exciting. The report highlights both our collective progress and the significant work that still lies ahead to ensure that every child's right to be registered at birth and have a legal identity is fulfilled. So, but you know, what's good about it, the excitement is that we know there's been progress, and therefore we can do a bit more to get where we want to. So despite COVID-19's severe impact on the CRBS systems, countries have actually bounced back more quickly than we had expected. Over the past 5 years, we see that global birth registration rates have risen from 75% to 77%, with more than 500 million children under 5 now registered. These numbers, like I said, are encouraging because they reflect the tireless efforts of governments, of communities, and of UNICEF to prioritize birth registration. During the year, I've been to several countries, and to see the progress that has been made in a space of a few years is just so encouraging and gives me so much hope. These numbers that we see really give us, for me, I think that's what sometimes when we look at just the number, it seems daunting, but when you see the progress, you can say, okay, we can get there. Having said that, there are still 150 million children under 5 who remain unregistered, and an unregistered child is invisible. These children are invisible to government systems. They're denied access to their rights and services like healthcare, education, protection. Furthermore, there are about 37 million under 1 who are also unregistered. And this gap between the under 5 and the under 1 registration rates actually remains a key concern. So the key is to reverse this trend so that no backlog of older unregistered children is generated. Clearing that backlog has become a vicious circle, and that takes away the focus from the under 1 registration. And again, during my visits this year, I've had these discussions with several registrar generals about how do you clear this? How do you close that gap? Another area that requires urgent focus is the gap between registration and certification. So that gap too has reduced, but we still see 55 million under 5s and 16 million under 1s registered children without a birth certificate as a proof of their legal identity. In terms of geographical coverage, Sub-Saharan Africa, with only 51% of children registered, and home to over half the world's unregistered children, remains a priority. South Asia, with nearly 30% of unregistered children, also is a priority and needs to accelerate. And then there are several countries across regions that really need that last mile strategy to reach universal birth registration coverage. Those children most at risk, including refugees, IDPs, and the stateless. And these are key to leave no one behind. While Claudia will provide you with more insights into these numbers, I just want to take this opportunity to present UNICEF's contribution to these results, just very briefly. So we have been working collaboratively with more than 80 countries on CRVS and legal registration, legal identity related interventions. In the past 3 years, we played a key role in registering the births of 144 million children. Of these, 127 million children, which is about 88%, were also issued birth certificates. And this is thanks to our emphasis on a one-stop approach to registration and certification. The legal requirement for birth registration has expanded to 147 countries, which is up from 69 in 2017. So this is a big, big progress. Births are now registered without discrimination in 104 countries, up from 56 in 2017, and still a long way to go. While the report presents a stark reality of what still needs to be accomplished, it is also a call to action as we enter the last 6 years of the decade of action. We know what works. Proven strategies like decentralization, interoperability with other sectors, digitalization, and elimination of fees have consistently shown results. So the report also underscores the challenges ahead. From cultural norms and lack of political will to logistical barriers like cost and distance, these obstacles require innovative and tailored solutions. As Vidya said in the Botswana example, they knew what they needed to do, and they did that. And I think here too, each country may require different innovative solutions, and we need to find those. But again, this work actually goes beyond numbers. Legal identity is foundational to human rights and development. It safeguards children against exploitation, ensures their access to services, which you all know, and it also provides governments with vital statistics for effective policymaking. Birth registration is the cornerstone of civil registration and vital statistics systems, supporting not just SDG 16.9, but also contributing to multiple other SDGs, including those focused on health, education, and poverty reduction. So as we look to the future, we need to be 5 times faster than we have been in the last 10 years to achieve SDG 16.9 by 2030. Regions like Sub-Saharan Africa, where population growth threatens to outpace current gains, will need to accelerate several times to realize this. The 2030 agenda calls on us to leave no one behind, and SDG 16.9 offers us a tangible, achievable goal. So let's draw inspiration from the successes highlighted in this report to ensure that every child, everywhere, has the right start in life, a legal identity that opens the door to opportunity and protection. I hope you have a good session. Thank you.
Thank you so much, Shima. And it's now time to go into the details of the estimate. Of course, the publication contains several data points, is available online. We are going to include the link to the publication in the chat box. And I hope you're going to have time to look at the publication to find additional statistics. But here I am to give the big picture of where we stand today in terms of birth registration. Currently, according to UNICEF estimates, the world is at a 77% levels of birth registration for the population of children under 5. In other words, in the world today, 77% of children under the age of 5 are registered, have had their birth registered. This is equivalent to approximately 500 million children who have been registered over the last 5 years. Levels of birth registration vary significantly across the different regions of the world. Of course, we have reached universal birth registration in regions including Australia, New Zealand, and Europe, North America, but level of birth registration are at 95% or 94% in Latin America and the Caribbean, and in Eastern and Southeastern Asia. And this is where the last mile principle mentioned by Shima becomes very important. We are still in this region struggling to get the last 5 to 6% of children registered. Northern Africa and Western Asia follows at 86%, Central and Southern Asia stand at 78%, and at the bottom of the chart you have Sub-Saharan Africa and Oceania, excluding obviously Australia and New Zealand, which stands respectively at 51% and 26%. Now, looking at the distribution of the overall population of children under 5, depending on their registration status and region, we can see that again, the world is home to approximately 200 million children under the age of 5 who do not have a birth certificate. So more than 200 million children do not have a birth certificate, and of this total of over 200 million children, we have 150 who are not registered, and we have 55 million children whose births are reported as being registered. So they have been registered, but they do not have a proof of the registration in the form of a birth certificate. And as it was mentioned earlier, having a proof of registration is critical because without this proof, there are a number of impediments to accessing services and demonstrating age, which is critical for protecting children from certain child rights violations. So these come up to, again, 2 in 10 of the world children under the age of 5 were not registered, or 3 in 10 who lack a birth certificate. And here again, you have the overview at the regional level. And of course, it's important again to reflect on this difference between being registered without a birth certificate and being registered with a birth certificate in hand, which is obviously the highest level of protection that a family can reach. Now, where are the unregistered children located? Well, 90 million out of the 150 live in Sub-Saharan Africa. So this part of the world has, again, very high level of unregistration combined with a significant and growing population of children under 5. And I want to reflect a little bit on this demographic aspect, because if it's true on one hand that the progress in raising birth registration level in Sub-Saharan Africa has been relatively modest, it's important that we acknowledge that overall in this part of the world, the number of children registered over the last 5 years has increased and is significant because, of course, it's a part of the world where the population of children under 5 continue to grow. So to maintain the same level of birth registration, you need to be able to register more children. And this will be the case going forward. So the demographic aspect is significant for this part of the world. Central and Southern Asia follows in terms of the region with the second largest population of unregistered children at 42 million. So again, going back to the 150, we can see that 90 million are children in Sub-Saharan Africa and 42 million are children in Central and Southern Asia. The rest of the world follow, which significantly smaller numbers of unregistered children. If we look at now within Sub-Saharan Africa, we can see that the bulk of the unregistered children is in Eastern Africa, where 43 million of the 90 million unregistered children in Sub-Saharan Africa live. Now we want to have a look at the under one registration and certification level, because ideally children are registered immediately after birth to ensure this lifelong level of protection as soon as possible. Now, when it comes to the worldwide level of registration for children under one, it's lower. It stands at 71%. Now, going and looking at the levels for the two regions in the world with the lowest level of registration, we see that in sub-Saharan Africa, 46% of children under one are registered. So less than half of under one children are registered. And in Oceania, the levels are only 23%. Now, looking at the distribution of the overall population of infant, we can see that, again, there are 53 million infants who do not have a birth certificate today, and this number can be further disaggregated. It includes 37 million children under the age of 1 who are unregistered, and 16 million whose births are reported as being registered, but the parents lack proof of the registration in the form of a birth certificate. So here again, we see the same level of discrepancy between registration and certification, with certification being lower than registration. Now, looking again at the distribution, in this case, of the unregistered population for the population of children under the age of 1, we can see that here again, sub-Saharan Africa is home to the largest number of infants who remain unregistered, with 21 million children, of which half are in Eastern Africa. Central and Southern Asia follow in terms of the region of the world, with the second largest number of unregistered infants at 10 million. Now, let's try to look at the historical progress that has happened in the last 15 years as a way of also setting the pace or the expectation for what might follow. So this is the graph that displays the levels of birth registration over time for the world. Let's go back now for a second to 2008. At the time, 63% of children under 5 were registered. Today, we stand at 77%. So as we can see that there has been progress in increasing the level of birth registration. It's important to observe that this program has started to slow down in the last 10 years. It's something that we observe as level of birth registration increase, becomes gradually more difficult to reach the unregistered children unless innovations are introduced to reach this level of scale for the entire population. So for us to be able to reach 100%, obviously, the efforts needs to be accelerated. If we were to continue the progress that we have seen in the last 15 years going forward, by 2050, the world will also not be able to celebrate universal registration. If projected levels of progress continue, we are going to be at 91% by 2050. Now, if levels of progress are accelerated, so meaning if the countries follow the pathways of the high-performing countries when it comes to birth registration, we could reach 97% by 2050. So we will still be falling short of the ambition of reaching universal birth registration. So to meet the target that's set by the SDG agenda, the progress we have witnessed in the last 15 years has to be 5 times faster than what has been the case. And we wanted to take a moment now to look at numbers, not just levels of birth registration, but really the millions of children who are unregistered today and what we project these numbers to be going forward to 2050, with a particular focus on sub-Saharan Africa. As I mentioned earlier, sub-Saharan Africa is currently home to 90 million unregistered children. So what does the future look like for this part of the world, or is expected to look like for this part of the world? Well, if prevalence of birth registration remains at today's level, we expect to have 114 million unregistered children in 2050. Why? Because of the demographic effect I was mentioning earlier. So keeping up the same level of birth registration, which already requires significant investment for countries in sub-Saharan Africa, will not be enough because the demographic growth of the population is such that this number of unregistered children will continue to grow up, even if the levels and the prevalence of birth registration remain the same. But what's going to happen if instead we continue the progress, or even better, we accelerate the progress? Well, that 90 million will start to go down dramatically. So if this part of the world is able to continue the progress that has been seen in the last 15 years, the number of unregistered under 5 children will go from 90 million to 52 million by 2050. And if progress accelerates, meaning if countries in Africa follow the example of the highest performing nations, the number of 90 million will go down to 22 million. So we are going to have 68 million children register in this time frame, and obviously with the number going down significantly. Now, I wanted to take a couple of more minutes to reflect on the situation in sub-Saharan Africa, looking at this dynamic of increasing birth registration level and population dynamics. So on the top of this slide, you will see the percentage of children under the age of 5 who have had their birth registered over time. And you can see that for sub-Saharan Africa overall, in 2008, the level of registration was about 39%. So only 39% of children under 5 were registered at the time. This number increased to 45% in 2013, reached 49% in 2018, and now stand at 51%. We finally reached the majority of children in sub-Saharan Africa registered. And we can see that the pathways and the speed of progress has been different depending on the sub-regions of Africa. Obviously, we have Southern Africa, which has the highest level of birth registration and has been growing from 76% to 88%, followed by Western Africa, where birth registration level jumped from 42% to 63%. Progress has been less significant in the case of Eastern Africa, where progress has gone, or level of birth registration have gone from 31% in 2008 to 41% in 2023. But in the case of Middle Africa, we see that overall there has been decline and stagnation. So this is the part of the continent where progress in birth registration has not been seen, and where particularly efforts and investments need to take place, obviously together with Eastern Africa, to allow these two regions to catch up with the rest of this part of the world. So looking at the projection, so looking at the future, and again, replicating the progress that has been seen between 2008 and 2023 will not be sufficient to achieve universal birth registration by 2050. If progress that we have seen in the last 15 years continues, we expect to reach 58% in 2030 and 78% in 2050. If progress is accelerated, we are going to be at 79% in 6 years and 91% by 2050. So again, still falling short of the ambition, but a significantly higher level of birth registration. If the countries in this region, all of them, can replicate the success story that we have seen happening in certain countries in sub-Saharan Africa. Now, when it comes to Central and Southern Asia, We also see this dramatic progress that happened between 2008 and 2023, mirroring mostly the progress that we have seen in the most populous country in the region, India. Overall, in this region, level of birth registration went from 40% to 78%, and in Southern Asia, it went from 39% to 76%, while in Central Asia has been staying pretty constant around 97, 98, and 99%. So the progress we see in the overall region of Central and Southern Asia is the progress that we see in Southern Asia and mostly in India, but other countries in the region have also had a significant progress, including Bangladesh and Nepal. So going forward, the region is not on track to achieving universal birth registration by 2030. But if progress that we've seen in the last 15 years is accelerated, universal birth registration can be reached in this part of the world by around 2035. 2035, we should reach 100% if progress is accelerated. If progress continue, as it's been the case over the last 15 years, we will fall short of achieving universal birth registration even in 2050. And lastly, of course, we wanted to acknowledge the situation in other parts of the world where level of birth registration have historically been higher. But it's important that we reflect on these regions because in all of these regions, we're still missing a significant proportion of children, and we know that we want to achieve universal birth registration. We do not want to leave any child behind. So Latin America and the Caribbean, Eastern and Southern Africa, Northern Africa, and West Asia have all reached birth registration level of above 80%, but we can see, particularly in Latin America and the Caribbean, but also in Northern Africa and Western Africa, levels have stalled. So these two regions have not been able to achieve universal birth registration, and therefore they are not on track unless, again, a significant investment and targeted investment addressing those who are left behind are introduced. And I want to conclude with just showing where this publication can be found, and obviously restating the importance of birth registration, and that's why UNICEF continues to be working with governments and other stakeholders in ensuring that all children are registered at birth, but also that we have the data to document what has been done and what remains to be done. And this is the UNICEF dedicated data website, data.unicef.org, where you will find the official SDG databases that UNICEF compile on behalf of the member states and made available for the Secretary General SDG report, as well as for any other use. On the same website, you will find our publication, including the one that we present today. And of course, we will be continuing to produce these estimates at regular intervals. Birth registration estimates at the country level will be published every year, but the global and regional estimates are meant to be published every 4 years. So in 2028, we will issue new global and regional estimates of birth registration. And it's now my great pleasure to introduce Kirsten DiMartino. Kirsten, she's a senior advisor in the child protection team in the program division of UNICEF New York, and she will guide us through what needs to be done to ensure that every child is registered at birth. Over to you, Kirsten.
Thank you so much, Claudia, and good morning, good afternoon, good evening to all colleagues who have joined us. So we heard a lot about the figures and the numbers, but now what is it that we can do? What will it take really to achieve universal birth registration and ensure that every child has a legal identity right from birth so that their rights can be fully protected? We have good news. We actually know what works. We have a lot of evidence of how to accelerate progress, how to expand coverage through sustained investments in high impact strategies. And there are really 4 key strategies that have proven time and time again to really, really work. One is partnering with the health sector Timely registration at maternity wards and immunization centers works very effectively. The second key strategy is decentralized services, going closer to the communities where children are born to register them immediately, streamlining processes, adopting the one-stop approach to birth registration and birth certification simultaneously, and of course using digitalization as an enabler, but safe and cost-effective digitalization. The other key priority is around legal reforms. We have to align national laws with international standards, making sure these are non-discriminatory, that they are inclusive and equitable for all children to be registered. We also have to secure multi-level engagement. We have to gain government support, of course. They need to understand that this is a smart investment, not only from a human rights, but also from a development perspective. And we need to support them in the cost of inaction. What will happen if they don't take action? And at the same time, we have to empower communities to demand birth registration as a right. We also have to focus, as we've heard from the previous speakers, on the last mile strategies, targeting those regions where there are still disparities and really focusing on the leave no one behind agenda. And last but not least, we have to commit to collective action. We have to leverage global and regional partnerships to really enhance systems and support vulnerable children. So the report calls for 5 key calls to action, as we call them. And the first one really relates to register every child at birth. What does this mean? It means that we need to establish really birth registration as the foundation for a life cycle approach to legal identity, from birth to death, with all the vital events that happen in between. We need to register birth immediately. The Convention on the Rights of the Child says in Article 7 that children should be registered immediately after birth. It is the only time that the Convention uses the word immediately, so hence the importance of getting this right from the start. And we need to facilitate this immediacy, this timely registration by ensuring it happens in health facilities, or it happens wherever the child is born in the community. We need to also try and assign unique identification numbers during the registration process to establish an organic link between and the shift from civil registration and vital statistics to the civil registration vital statistics identity management approach. And these need to go hand in hand. Aligning CRVS and ID systems is really, really important. We need to, because it enables us to collect information once and use it multiple times. It really, really facilitates the data flow across systems and hence enables to protect children throughout their life and into their adulthood. The second call to action talks about streamlining registration processes. As I said before, we need to promote one-step, one-visit processes for registration and certification so they happen close to the community and that they happen simultaneously. We need to also simplify late and delayed registration processes and be sensitive in particular to the needs of those that tend to be most excluded, such as migrant children, displaced children, those who are refugees, IDPs, or stateless. We also need to promote and ensure free registration without cost and ensure that at least the first birth certificate for all children is provided free of charge. And then we need to avoid inefficiency by digitalizing CRVS systems to ensure inclusivity and accessibility to all. The call to action 3, I think we can move on to the next slide. Thank you. So the third call to action talks about leveraging the health, social protection, and education sectors by enhancing interoperability, or sometimes as we call it, twinning between the civil registration vital statistics system and these sectors and systems. And this really enables to create more opportunities for timely registration of children. We need to integrate birth registration within the maternity wards and immunization desks, and we need to shift responsibility to health facilities for declaring births so that we reduce the parents' travel burden and cost. We need to also engage more actively community health workers and the social service workforce to help declare births, especially also births that take place at home, and refer unregistered children. And finally, we need to use schools and social protection schemes to really identify the older children that were not registered at birth and facilitate their registration. So creating that as using that as an opportunity for birth registration rather than as an additional barrier. The call to action number 4 talks about implementing legal reforms for inclusive CRVS systems. First of all, we need to make sure that mothers can declare their births independently, removing barriers like requiring a father's name or marriage certificate to be there, so that even single or unwed mothers can actually register the birth of their child in a timely manner. We need to register newborns regardless of parental documentation, particularly in migration and displacement settings. Birth certificates should also exclude any sensitive information related to the nationality of parents, for example, to prevent discrimination. We also need to protect CRVS systems from misuse and ensure that data privacy and security are guarded at all times. And finally, we need to ensure that CRVS systems remain inclusive, equitable, and accessible to all populations. And now to the call to action number 5, the last call to action is all about empowering communities to demand registration as a right. We need to educate communities about their right to register the children immediately at birth, and how important and essential this is for accessing services and protecting their rights. We need to be targeting the underserved groups of the populations, which I have mentioned before, and we have to strengthen the partnerships with local leaders, health workers, educators, social service providers to help them to be agents of change and to be promoting birth registration at the community level and with families. But most importantly, we need to be fostering a culture where civil registration is seen as a fundamental human right and a shared community goal. So what is next? What should we be focusing our attention on? First of all, we need to prioritize interventions in the 10 so-called high burden countries, those countries where we have the biggest number of children that are still not registered, if we really want to shift the needle and make significant progress towards SDG 2030. Second, we need to emphasize and put a special focus in our interventions, in our actions, and in our programming on countries in humanitarian settings and in places where we have large populations of children who are migrating, who are displaced, who are refugees, or who are stateless. We need to focus on the last mile strategies, as I said before, for those countries with registration levels in the 80 to 90% range. And we have to invest more in the cost of inaction. We need to magnify the economic consequences of underinvesting in CRVS systems so that governments understand the impact this will have for the human rights of their population, but also in achieving their development goals. And last but not least, we need to be promoting CRVS as the foundation of the digital public infrastructure. The digital public infrastructure is really there to enable the use of digitization as a transformation, helping to improve public services and deliver at scale so that countries can really achieve the SDG targets. Thank you very much.
Thank you so much, Kirsten, for your remarks, putting everything in perspective. So we have reflected on the numbers, we have reflected on the actions, that are needed to achieve birth registration. Now we have approximately 10 minutes to address your questions, and I can see already that there are a few questions in the Q&A. But of course, please use the Q&A, but also if you would like, raise your hand to be able to to, uh, to ask your question in person. So let me start with Xenia. How is it possible to make sure that the issued birth certificate belongs to the specific baby? Birth certificates are usually paper-based and easy to fake. Are the countries introducing biometric registration of children besides birth certificates and parents' ID credential? How is it possible to combat child trafficking if their ID documents are not secure enough? So, Kirsten, would you like to take this one?
Yes, thank you very much. That's a big question. I will try to answer briefly in the time we have, but really, I think I would like to start by saying that the accuracy of a birth certificate is usually as good as the accuracy of birth registration. And it really depends how well the mechanisms are in place to verify and validate the credentials of the birth certificates and the parents. So there are, of course, you can use QR codes, barcodes, and other security features, but usually the ones that work, the way to verify that works best is the online validation process. Another way is also to issue unique identifying numbers, which I talked about in my presentation during the birth registration process, by link, so that this can be linked to the parents' credentials, especially mothers, and that also can help to ensure that there is no misconduct in the process. And finally, with regards to biometric registration for newborns or even for under 5 years, that may not always be the best solution. It may be detrimental to the overall process, and there are some risks involved there. So really the unique identifier numbers and getting the process right in terms of the credentials verification at the moment of birth registration is really key to making sure these things do not happen. Thank you.
Thank you, Kirsten. I'm going to take two questions. One refers to universal birth registration, whether we are making reference to all populations in the country or for the newborn. The data that we are presenting reflect and cover children under the age of 5 and under the age of 1. So we are not referring to registration of all members of the population, but only children under 5 and under 1, which also should address the question from Zamira, who is asking, are there data on the number of children over the age of 5 who are unregistered and lack of birth certificate? No, the data that are currently collected in household survey refer to the population under 5. Obviously, if we rely on CRBS data, normally tend to refer to the number of births that occur in a given year. Obviously, countries that have sustained level of birth registration at 100% or even above 100% above 90% for the population under 5, we expect that this country then will sustain the levels going forward, and therefore the entire population will be registered, provided that, of course, as Kirsten mentioned, the right strategy for sustainable birth registration are adopted. Yeah. And then a couple of questions actually from Belay, who is connecting from Ethiopia. So, and he has the following questions: how the birth registration process in conflict, how the birth registration process work in conflict-prone areas, and what can we do to mitigate the challenges? I'm also going to read the other questions, Kristen, so you have a chance to answer all of them. What mechanisms are used to understand the cultural variations that exist across countries in reporting the actual age and the number of children, and how the birth registration process explain the intent of the child certification to parents or other significant others, to minimize biases that rooted from their perceptions. So how do we address parents' lack of knowledge about the registration process, but also about the importance of registering children?
Okay, thank you. Many questions. I'm trying to digest them all. So taking maybe one by one, the first one is about the conflict-prone areas mitigate the challenges. Of course, I mean, the starting point is to build, of course, resilient and robust civil registration and vital statistics systems, right? That ideally can withstand also humanitarian scenarios, whether these are conflict scenarios or even natural disasters, for example, or large displacement, whereby ideally, for example, the information that the civil registrar has collected is kept in the cloud, as I call it, right? Is kept somewhere safe that it can be easily retrieved and accessed should it be lost during conflict or other natural disasters. So would be the ideal starting point. Of course, then we work in many countries, and I think my colleague here, Basker, is online, who can speak more to that, where we do then, once we do have displaced populations, for example, living in refugee areas, in camps or so forth, where we do try to set up and work with our local counterparts to register these children. Many of them may have lost their documentation because they left in a hurry, for example, cross borders. Some of them may have purposely destroyed that documentation in fear of their lives or repercussions or discrimination against, for example, certain ethnic minorities, or others may be in situations where the child was born on the way, the mother gave birth while she was on the move, so to say, or even had the child in the camp. So what we promote is to set up with our partners. Sometimes we also work very closely with UNHCR to register these children and make sure they at least obtain a birth certificate. So those are just some top lines with regards to conflict-prone areas and mitigating and addressing those challenges. I'm looking at the second question. What mechanisms are used to understand the cultural variation exists across the region, reporting the actual age and number of children that might affect the child birth rate data quality? Okay, this is a question that I might throw back at either Basker or you, Claudia. Basker, do you want to come in on that one? I know you're online. Is he there? No, he can't hear me. Okay.
Let me come in on the issue. Obviously, this affects not just birth registration statistics, it affects the overall design of a survey, right? One of the most important information to obtain in a survey is precision when it comes to the age of the child. So the household survey, we have a roster where the household head is expected, or the respondent to the household questionnaire is expected to list all the members of the household and provide their age. Obviously, we have techniques that are used by the interviewers to facilitate the disclosure of the correct age by the mother or the primary caregiver. It is complex. We don't deny that. It tends to be more complex for older children than, for the youngest children tend to be obviously slightly easier because the period of recall is shorter, but there are techniques. It's not that much cultural variation in age. The reporting of the age is the reporting of the age, but of course not everybody celebrate birthdays and have these the documents to have accuracy in ages, but this affects the overall questions asked in surveys. Yeah. And then there was another question, Kirsten, about addressing really the knowledge of the birth registration process and the importance of registration as well.
Yeah. Well, as I said before, it starts first of all by awareness raising and educating the local communities about the importance of birth registration. But in order to do that, there has to, it's a supply demand aspect, right? The demand will grow if you can provide can address the supply issues. So you need to make sure that the population understands the benefits of what they will get in terms of accessing services, in terms of their children being able to get healthcare, in terms of being able to go to school, etc. And you then have to also make sure that actually happens, right? Because if it doesn't happen, then it's very hard to push the demand side of things. So really, they need to see the added value of getting their children vaccinated, of getting their children into school, etc., etc. So again, also working with the health sector, twinning with the health sector is very important in this respect, right? At the community level, working with community health workers so that mothers and parents really see the benefits of having their child registered. There is, of course, the other side as well, that if they need to be made aware. If they don't register in a timely manner, the process will get more and more complicated. There will be fines, and there will be huge indirect costs for them as well. But of course, that's not a positive approach, right? It's better to give the incentive and to meet the supply demand factor to encourage people to really claim this right.
Thank you, Kirsten. And there are a couple of questions related to birth registration in rural context. For example, Joseph was mentioning a critical strategy for register the children at birth is linking registration to delivery of babies in hospitals. But in many African countries, in rural areas, there are less hospitals, obviously, and a lot of deliveries still happen at home. What can be done to address the issue of birth registration in rural areas, for example?
Yeah. Well, there's what I said before. We really need to work with the community actors, right? If there are community healthcare workers, if there are the social service workers at community level, even if there are, community leaders or community, whoever is at the community level that can help to register these births and do the declaration. And then, of course, there is the enabling factor. There's the digitalization, right? There are countries where we have used those kind of tools through the mobile phones, through different devices, different apps, to be able to declare those births and have it sent back, linked back to the civil registration system, so that children who are also born at home in communities can also be registered as quickly as possible without additional costs of travel, access, etc., to civil registrars that may be further away.
Thank you, Kirsten. And the last question comes from Senia. Are there cases where you see resistance from governments to cooperate in increasing birth registration levels?
This is a good question. I don't know if we have per se governments who are outright saying they are against birth registration, but we do know there is discrimination, right? There is discrimination in terms of ethnic minorities, certain groups or populations that are seeking perhaps refuge in another country, who are excluded from discriminatory practices from actually being, registering their child at birth. So I think it is the discriminatory practices and factors that sometimes that need to be overcome, whether it is an ethnic group. There is also sex discrimination and CRVS laws, which we mentioned before, where in many countries, women who are not wed, who are single mothers, who cannot present themselves at the civil registrar with a man, cannot register their child. So there are a lot of discriminatory practices that may actually prevent children from being registered.
Thank you so much, Kirsten. And this completes the questions. I just have to take a moment to acknowledge also Nicole, who has been critical to the production of the report, but also has been handling a number of questions that were also popping up in the chat box, and she's been able to provide answers on the specific questions. We are at the end of the hour. And I just wanted to thank you for your participation in today's webinar. Thanks to the panelists, thanks to the interpretation services that we've been provided. And of course, we remain committed to continue the work on birth registration in terms of advocacy and programming, but also in terms of data and monitoring. Please refer to our website, both UNICEF website, as well as the website that is specific for data, which is data.unicef.org. Thank you so much. Please take some time to have a look at the publication, and do not hesitate to reach out to us if there is anything else that you would like address in your efforts and questions about improving birth registration for every child. Thank you so much, and we wish you a nice continuation of your day. Bye-bye, everyone.